Jurassic Park. Stand up, Jurassic Park. We scream the best. We're yelling for the number one team. Let's hear it for the Jurassic Park. Let's go. 1, 2, 3, 4. Let me hear you stomp the floor. T-O-O-T-H. Dude, E. Russian away. Say oh, 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 oh. Go red. Fight white. Let's go Jurassic Park.
It's a rare condition this day and age to read any good news on the newspaper page. And love and tradition of the grand design, some people say, is even harder to find. Well, then there must be some magic clue inside these gentle walls. 'Cause all I see is a tower of dreams, real love bursting out of every seam. It's the bigger love of the family.
Hello everyone, I'm Archel V. Flores, and today I will be giving you a little bit of a background on the tooth movement. So last week I asked you guys on Twitter what your curiosities are regarding the movement of teeth. And so today I will be answering your questions with all the knowledge that I can muster in my brain. So let's get started. So let's start off with our first question. Damn, I'm so excited guys. So our first question is from Harry Styles. So sabi ni Harry Styles, "Hi Art, I'm a fan." Hi Harry. Can you tell me a bit of a background on the eruptive process of the teeth? Hee XOXOXO exclamation mark. Okay, so great question. So first of all, XOXOXO exclamation mark to you too, Harry. So yung eruptive process of the tooth, it involves the major remodeling of the bone, which is yung alveolar bone natin, di ba? So syempre, the bone remodels to compensate for root growth and changes in the positional relations of the primary and permanent teeth. So I hope I answered your question well, Harry Styles. Thank you for that question. So our second question is from Celine Dion. So Celine Dion, meron po bang tawag sa development ng tooth movement? Love you po. Love you too, Celine. Wow, so much love from these tweets, no? Okay, so actually may tatlong phases ng tooth movement. And those are the pre-eruptive tooth movement, the eruptive tooth movement, and the post-eruptive tooth movement. Okay, so third question is from Oprah. Okay, so Oprah asked, "I'm curious about the direction of the movement of the teeth if nag-erupt na siya." Okay, so another great question. So ang direction niya ng teeth natin is anteriorly or facially and laterally or buccally. So like anteriorly and laterally. Okay, so ipapakita ko lang dito kasi mukha akong dinosaur.
Let's go Jurassic Park.
So here, anteriorly and facially, or laterally and buccally. Okay, so for our fourth question, it is from Gucci Lay. Ito, gets na get ko to. Guys, tingnan niyo yung tweet. Gets. Pa-translate naman, please. Okay, so na-translate na po. So, ang question ni Gucci Lay is, does the alveolus change during the growth of teeth? Okay, so Mr. Gucci Lay, yes sir po. Specifically, the height of the alveolus. So it changes in relation to the root growth as part of the facial growth process. So basically, accommodations are made for increased dimension of the permanent teeth. Okay, so we are down to our last two questions. So far, ang gaganda ng questions nyo guys, in fairness. Okay. So our fifth question is from Michael V. Jackson. So ang tanong ni Michael V. Jackson is, what is the mesial drift? Okay, so it is important to know this, guys. So ang mesial drift, it is a significant occurrence during the mixed dentition period. So when the teeth are clenched during normal masticatory function, an anterior force is exerted on the teeth. So most cusps are inclined anteriorly and their occlusal inclined planes therefore produce an anterior force. So this is in part the result of proximal wear. So summation of these forces defines the principle of mesial drift of the teeth. The alveolar process compensates for tooth-related factors such as increased arch size, as well as the effects of the occlusal function. The effect of tooth loss or hypereruption is mesial drift, which can result to the disruption of the normal occlusal function. So yes, I hope you took down that what I just said, because all that came from here. Last question is from Ko K. So, tanong niya is, hi Doc, ano po number niyo? Hehe, XOXO. Akala ko dental questions lang to. Tingnan ko sa'yo. Okay guys, so that is the end of it. Thank you for sending all your questions. And I hope I answered all of your questions, and also please stay tuned for the future videos of my colleagues regarding this topic. So thank you all. I love you so much.
Hello everyone, I'm Dr. Jen Ashley B. Punzalan. Today I will be answering the web's most searched questions about pre-eruptive tooth movement. Let's start. Okay, so we have here what and how. And let me start with what. So for the first question, what are the patterns of tooth movements? So this is a good question to introduce the pre-eruptive tooth movement, and to answer this question, there are three patterns of tooth movement. First is the pre-eruptive tooth movement, which this segment is all about. The second one is the eruptive tooth movement, and the third one is the post-eruptive tooth movement. So for the next question, we have here, what is the pre-eruptive tooth movement? So pre-eruptive tooth movement is the phase when the tooth germs moves within the jaw before root formation. It is also considered as the positioning of the tooth and its crypt within the growing jaws preparatory for tooth eruption. Next question we have here. What happens in the first differentiation of tooth germs? Okay, so when deciduous tooth germs first differentiate, they are very small and a good deal of space is between them that will be used when they grow, and also this will cause crowding of the tooth germs in the incisor and the canine region. However, when the jaw grows in length, it will permit drifting of the tooth germs and it will relieve the crowding of the tooth germs. Next question we have here, what is the bony remodeling of the crypts? Okay, so bony remodeling of the crypt wall happens or occurs to facilitate the growing tooth germs and its movement. So for the next question, what is the bodily movement and eccentric movement? So in this question, we can understand more about the bony remodeling of the crypt, since the pre-eruptive tooth movement is accomplished by two processes that is assisted by bony remodeling of the crypt. And these two processes are called the bodily movement and the eccentric movement. So for the first process, the bodily movement, it is the movement of the entire tooth germs that is assisted by the bony remodeling of the crypt. For example, in a mesial direction of bodily movement, the bone will resorb on the mesial side of the crypt and it will form on the distal side of the crypt. Now for the next process, the eccentric movement, this is a movement, or this is a process of growth that happens on one part of the tooth while the other part remains the same. or is not affected. This process is also assisted by bony remodeling of the crypt. So we're down in our last question, in what category, and let's see. So for the last question, in what category? What happens in pre-eruptive tooth movement? Alright, before that, you have to understand that tooth germs move in relation to each other and simultaneously with the growing jaws in length, height, and width. And for the anterior tooth germs, it will move mesially while the molars will move distally. And the growth of the jaws in width and height will move the tooth germs buccally for posterior tooth germs and facially for the anterior tooth germs. Now for the maxillary tooth germs, it moves downward. On the other hand, the tooth germs in the mandible will move upward. In relation to primary tooth germs, the permanent tooth germs move as well, and the permanent tooth germs lie lingual to their primary predecessors with the same occlusal plane initially. But at the end of this phase, the pre-eruptive tooth movement will position the permanent anterior teeth lingual and apical to the primary anterior teeth. And the permanent premolar will be positioned under the divergent roots of the primary molars. Now let's move on with the how. For the first question in how category, how does tooth germs of permanent molars move in pre-eruptive tooth movement? Good question. Alright, for basic knowledge, if you're a dentistry student, you should know, and I hope you know, that permanent molars do not have primary predecessors. That is why they are positioned differently from those that have primary predecessors. For example, the maxillary molars will be positioned with their occlusal surfaces and are tilted distally, while the mandibular molars, on the other hand, will be tilted mesially. You see, permanent molars want space, that is why they are positioned this way. But after the maxilla and mandible have grown sufficiently, the permanent molars will be positioned vertically. And for the last question, we have here, how does pre-eruptive tooth movement happen histologically? Well, histologically, pre-eruptive tooth movement begins in the early bell stage and ends in the beginning of root formation. And whether it involves the drifting or growth of tooth germs, it will demand remodeling of the bony wall of the crypt. And it is achieved by the selective deposition or removal of bones by osteoblastic and osteoclastic activity. And whether such bony remodeling is the cause of the pre-eruptive tooth movements or it reflects a response to forces caused by other factors, that is not known. It is of interest that there are instances that indicate normal skeletal morphogenesis might be involved in the determining of the tooth position. Those narrow spaces of consistent configuration develop in bones, and through eruptive pathways, bones will form even in the absence of associated teeth. And the intraosseous phase of the tooth eruption can be considered as a process of bone remodeling. So that's it. Again, I'm Dr. John Ashley B. Punzalan, and this is Webb's most searched question about pre-eruptive tooth movement.
Hi, I'm Patricia Aliaf de la Serna, and for today, I'm so excited to do this segment with you. Ang hashtag, itanong mo sa'kin. Okay, so now I will try to answer some of your questions that you've sent me on my Twitter account, and I wanted to thank you for sharing your insights and having, something curiosity about our topic for today. So thank you for sending your questions. Okay, so first tweet of the day. Okay, from @Titus of Manila. What is tooth eruption? Can you tell us something about it? Okay, so simply said, tooth eruption is a process in the tooth development in which the teeth enters the mouth and it will become visible. But it is more than that. For tooth eruption is a complex process. It involves a lot of mechanism that controls eruption. And these mechanisms involves the movement of the tooth from its position within the bone of the jaw toward its functional position in occlusion. Okay? Next question. From at Stu Dentistry. What is the principal direction of movement of tooth? Okay, so the principal direction of the movement of tooth is occlusal or axial. Next is from at Jungkook. Annyeong! What are some of the following events occur in eruptive movement? So, in physiologic tooth movement, a lot of developmental events occur that are associated with eruptive movement, like the formation of roots, the periodontal ligament, and the dental-gingival junction. Okay, so before I proceed to the next question, let's do a recap lang. So now, we know na that tooth eruption is not just a simple process, but it is a complex one because it involves a lot of mechanisms, and the principal direction of the tooth movement is occlusal or axial, and lastly is it also involves a lot of developmental event that occurs in eruptive tooth movement, like nga yung mentioned a while ago, the formation of roots, periodontal ligament, and dentogingival junction. So now, the next question is from Jimin. What is the one responsible for root formation? Okay, so the one that is responsible for root formation, or the one that initiates the root formation, is the growth of Hertwig epithelial root sheath, which then initiates the differentiation of odontoblast from the dental papilla. This odontoblast forms the root dentine that leads to increase in length of the root accommodated by eruptive tooth movement, and simultaneously, it is the time wherein the root formation also begins. Then, as root formation starts, the cementum, periodontal ligament, and bone lining of the crypt wall are formed. So, periodontal ligament develops only after the root formation has been initiated. When established, the periodontal ligament must be remodeled to accommodate the continued eruptive tooth movement. And the remodeling of periodontal ligament fibers is achieved by the fibroblasts. These possess as part of their cytoskeleton intermediate filaments that consist of contractile proteins. They exhibit numerous contacts with one another of the adherence type and a further specialization involving the cell membrane, the fiber nexus. Alright, so far I hope that you understand the information that I have imparted with you. And now we'll proceed to the third and last question or last tweet of the day. And it is from at MacDreamy. Okay, at MacDreamy. Can you tell us more about the eruptive phase movement of tooth? So, in continuation with what I have mentioned earlier regarding the root formation, periodontal ligament formation, this describes a morphologic relationship between the intracellular filaments of the fibroblasts, transmembrane proteins which produce an increased density of fibroblast cell membrane, extracellular filaments, and fibronectin. Fibronectin is a sticky glycoprotein that can stick to a number of extracellular components including collagen. And fibronexus consists of intracellular actin filaments and extracellular fibronectin filaments associated with plasmalemmal plaque material that contains proteins such as vinculin, talin, alpha-actin, and integrin. And finally, the ligament fibroblast has the ability to ingest and degrade extracellular collagen while forming new collagen fibrils. Bone removal is necessary for permanent teeth to erupt, and when the successional tooth germ first develops within the same crypt as its deciduous predecessor, bone surrounds both tooth germs but does not completely close over them. And as the deciduous tooth erupts, the permanent tooth germ becomes situated apically and is entirely closed by bone, except for a small canal that is filled with connective tissue and often contains the epithelial remnants of the dental lamina. And this connective tissue mass is termed as the gubernacular cord. As the successional tooth erupts, its gubernacular canal is widened rapidly by local osteoclastic activity, delineating the eruptive pathway for the tooth. And after removal of any overlying bone, there is loss of the intervening soft connective tissue between the reduced enamel epithelium covering the crown of the tooth and the overlying oral epithelium. The changes taking place in this connective tissue affects the epithelial it sustains, and both the reduced and dental epithelium and the overlying oral epithelium begins to proliferate and migrate into the disorganized connective tissue. The reduced enamel epithelium and the overlying oral epithelium come into contact with each other and eventually fuse. The central cells of this epithelial mass degenerate and form an epithelial line canal. The central cells of this epithelial mass degenerate and form an epithelial line canal through which the tooth erupts without any hemorrhage. This epithelial cell mass is also involved in the formation of the dental-gingival junction. Once the tooth has broken through the oral mucosa, it continues to erupt of the same rate until it reaches the occlusal plane and meets its antagonist. Rapid eruptive movement then ceases. So that's all for our segment for today, or ang hashtag itanong mo sa'kin. Thank you folks for watching, and I hope that you learned something from me, and let's all learn something new every day.
Hi guys, so I am Dr. Beatrix and I am back to answer your daily questions. So, I asked you guys earlier on my Instagram, what do you want to talk about in this video, or what topics are you most interested in? So, most of you asked me, what is post-eruptive tooth movement, or what happens in post-eruptive tooth movement? Some of you asked, what age does the post-eruptive tooth movement occur? So, we'll talk about that in this video. So, post-eruptive tooth movement is the phase where the tooth makes movements primarily to accommodate the growth of the jaws. It starts after the teeth reaches functional occlusion and is continuous while the teeth remains in the oral cavity. So, it occurs most actively, or its peak occurrence is between the age of 20 years old and 80 years old. It is associated with condylar growth, which separates the jaws and the teeth. Its principal movement is axial direction. So, it is generally assumed that when there is too much occlusal wear, there is also a continuous deposition of cement around the apices of the tooth, accompanying this occlusal movement to compensate for attrition. So, occlusal wear is where there is a loss of tooth structure due to rubbing of tooth against tooth. This usually takes place on the chewing surfaces of premolars and molars. This can be caused by biting on eyes, bruxism, or clenching. So, when there is too much occlusal wear, then it can result to attrition. So, but there is no evidence that will prove that this cemental deposition actually moves tooth. It is said to be that it is more likely to be that the forces causing the tooth eruption are still available to bring about sufficient axial direction movement of the tooth to compensate for the occlusal wear that is attrition. So, when the teeth are brought together in occlusion, an anterior directed force is generated, and it is responsible for the mesial drifting of the tooth. This anterior directed force is said that it is the transeptal fiber of the periodontal ligament, and the soft tissues exerted by the force of the tongue and cheeks that can generate a force that will push the teeth mesially. but wear also takes place at contact point between teeth and to maintain tooth contact where mesial or proximal drift takes place. So, histologically, this drift is seen as a selective deposition and resorption of bone on the socket walls by osteoblast and osteoclast respectively. So, and with the electron microscope, collagen remodeling in both periodontal and transeptal ligaments are seen. That's all for today. Thank you for watching.
Hi guys, I'm Dr. Galen Lucero from the Jurassic Pop group of dentists, and today we'll be doing things a little bit differently. I have our YouTube page open in front of me, and I'll be reading and answering some of the comments that you guys have posted in the past videos. Let's get started. First up is Clarence. He says that I recently got braces and I would like to know what they do to my teeth that helps them in having a proper alignment. Well, that's a great question, and right up my alley since I am an orthodontist. So the braces help lead your teeth to the right position and alignment. What occurs is a type of movement called the orthodontic movement. Now, what is orthodontic movement? It is the movement of teeth through the alveolar bone. So you see, the tooth will move towards the direction of the orthodontic force applied. Example, when you pull an object, it moves towards you, and when you push, it moves away from you. The same thing happens to our teeth. The braces pulls the teeth towards a certain direction using a specific amount of force, and the tooth will then move towards that direction. The tooth will then continue to adjust until no more force is applied. That is how braces help your teeth align. My answer in that one was a bit long, but I hope you all understood. Next is Trina. The bone is a hard tissue, so how exactly can a tooth move through something as hard as the alveolar bone? That is correct. The bone in tooth is a hard tissue, but there is a way for the tooth to move through the alveolar bone. Now, when you think of a pull, you just think it's one strong force pulling an object towards you, but no, it is different for the tooth. First of all, only a light force is applied. And second, since the tooth moves in the same direction as the force applied, it results in immediate movement of the tooth. However, that movement relies on coordinated tissue resorption and formation in the bone and periodontal ligament surrounding the tooth. It results in an area of compression and an area of tension. The area that is being compressed is the part of the periodontal ligament and the bone that is being pushed by the tooth, and the area of tension is the part that is being pulled. Therefore, it is the opposite side. Now, as the tooth is being pulled, it continues to compress against the alveolar bone and periodontal ligament, therefore resorbing the bone and rearranging the different structures. While on the opposite side, the area of tension, there is bone deposition to make up for the empty space left by the tooth. Now we have Nikki. Her comment is not actually a question. She says that, I am an aspiring dentist and your videos help me learn more about my dream job. Thank you so much. Well, Nikki, you don't have to thank us, but we appreciate the support. After all, that is our goal, to help everyone learn more about dentistry and hopefully inspire the next generation. The next question is from China. She says that, I also recently got braces, and it often hurts. Is this normal? Yes, it is a side effect of having braces. Since the tooth is being moved by outside forces, of course it will tend to hurt. The movement of the tooth will not only affect the tooth, but also the surrounding structures like the periodontal ligament and the bone. The tooth and the surrounding structures contain nerves and blood vessels. That is why orthodontic movement is known to cause inflammatory reactions and the feeling of pain in the oral cavity. But keep in mind that what you're experiencing is normal because the tooth is moving through the bone. However, you can always go back to your dentist to have them check if there isn't anything bad happening. So the last comment I'm gonna be reading is from Janella. She asks, why do we have to wear braces for a long time? Okay, first of all, the duration that you will need to wear braces depends on the degree of your teeth's malocclusion. And second, since only light forces can be applied on the tooth, they can only make minimal movements. That is why it might take a while for them to reach their proper alignment. You may ask, why can they make only minimal movements? Why can't we make them have bigger movements through the alveolar bone? That's because by doing so, it can result in damaging the tooth, the structures within the tooth, and the structures surrounding the tooth. Too rapid movement can lead to damage of the vessels supplying the pulp, which can result in eventual pulp necrosis, since the tooth is not getting enough nutrition. In order to avoid that from happening, you need to be careful when adjusting your tooth, and that is also why you need to go back to your dentist every few months so they can make adjustments to your braces to have continuous movement. And additionally, the placement of the brackets, their positioning, and the other components of your braces is important in achieving the proper tooth alignment you need. That's why you need to have them adjusted constantly. So that is all, guys. Today we focus on the mechanics of your braces. I hope you enjoyed listening to my overview of the orthodontic tooth movement and understood their importance and what they do to help your teeth. Until next time, don't forget to like, subscribe, and comment. See you soon!
Hi guys, this is Dr. Ira Valerama and welcome back to my channel. For today's video, we're going to answer some questions on Twitter with the hashtag #DentistAnswersToDentalTweets. So let's get started. For the first question from @0_deaths, the question is, what is pathologic tooth migration? Pathologic tooth migration is defined as tooth displacement that occurs when the balance among the factors that maintains the physiologic tooth position is disturbed by periodontal diseases. For the next question, it is from @pixie_dust. What are the two major factors that plays an important role in maintaining the normal position of the teeth? The first major factor that plays an important role in maintaining the normal position of the teeth is the height and health of periodontium. It is a proven fact that the periodontal destruction is usually a significant factor in the etiology of pathologic tooth migration. It was noted that more bone loss and more attachment loss was seen with respect to migrated teeth. Now, for the second factor, it is the forces exerted on the teeth that can be grouped into two. The first group is the forces of the soft tissue, which includes the lips, the cheeks, and the tongue. Pressure from soft tissues can move teeth, particularly those with weakened periodontal support. Also, oral habits such as lip biting, tongue thrusting, nail biting, thumb sucking, and playing wind instruments have been associated with pathologic tooth migration. Remember, the duration of force is more important than the magnitude. Therefore, the greater the duration of the habit, the greater the potential of the teeth that have a weakened periodontal support to move. Going on to the second group, which is the forces of the occlusion, it includes loss of tooth morphology, cuspal inclination, presence of full component of teeth, physiologic tendency towards mesial migration, nature and location of contact point, proximal, incisal, occlusal adhesion, finally, axial inclination of teeth. Third on the list is from @Anonymous. What are the etiology of pathologic tooth migration? Loss of periodontal support is the main factor that leads to pathologic tooth migration. Next is periodontal or periapical inflammation, gingival overgrowth, pressure from oral musculature, malpositioned cranial attachment, occlusal factors, trauma from occlusion. Another explanation for tooth migration is the chronic inflammatory process first proposed by Hirschfeld. According to Hirschfeld, gingival inflammation and edema may increase the pressure inside the periodontal pocket, which is then transmitted to the periodontal ligament. This theory is supported in part by the clinical observation of a tooth tending to migrate away from its deepest pocket. Fourth question is from @prince_charming. What is the difference between pathologic migration and drifting? The common factor between these two is the abnormal forces, but what differentiates one from another is that in pathologic tooth migration, abnormal forces is acting on periodontally weakened teeth. However, in drifting, abnormal forces are acting on teeth with a healthy periodontium. The next question is from @poison_ivy. What are the treatment modalities? Treatment modalities can include definitive packet therapy, alternative local drug delivery like antibiotic fibers placed in gingival sulcus. It is an option when the pathologic tooth migration is localized to one or two teeth. Restorative or prosthetic camouflage can be done in mild to moderate cases. Orthodontic treatment, but with minimal detrimental effect on periodontium that at least has 50% or more support. And finally, in teeth with severe pathologic tooth migration, extraction and replacement with a fixed prosthesis is advocated. Last question is from @babushka. Is there a treatment plan for pathologic tooth migration? In the Journal of Indian Society of Periodontology, it summarized a treatment plan based on the severity of pathologic tooth migration. For mild to early cases where diastema is less than 2 mm due to periodontal disease, the treatment plan will be scaling, root planing, and if required, a flap. For moderate cases, where along with the diastema, there is a certain amount of extrusion and flaring, the treatment plan includes periodontal therapy, orthodontic forces, but the point to be remembered here is to use light intrusive force and make sure to have at least 50% or more periodontal support. The last case, which is the severe, where diastema is greater than 2 mm, along with that is the severe extrusion and flaring due to periodontal diseases, the treatment plan includes extraction of that particular tooth and initiate a fixed prosthodontics therapy, either in form of fixed partial dentures or an implant. It seems like there's no more questions from my Twitter fam. So that ends our video for today. Again, I'm Dr. Ira Valderrama. Thank you for watching and see you on my next vlog.
Good morning everyone, I am Lester Molina from Jurassic Pulp, and for this time, we will be answering some questions about the theories of tooth movement. So to start off, by a question by Gio Brando, what are these theories about? So these are mechanisms that talk about the tooth movement, which can be a combination of several factors. Many possible causes or theories have been proposed, but lucky enough, 4 have been considered. These are the bone remodeling theory, root formation theory, vascular pressure theory, and periodontal ligament traction theory. Spoiler alert, you will realize the importance of dental follicle in this topic, so stay tuned. So giving you an overview about these theories, first is the bone remodeling theory, which talks about the selective deposition and resorption of bone, which brings about eruption. Second theory, which is the root formation theory, which supposes that the proliferating root impinges or it disrupts a fixed base, converting it in an apically directed force into occlusal movement. The third theory, which is the vascular pressure theory, which discusses about the local increase in tissue fluid pressure in the periapical region, which is actually sufficient enough to move the tooth. And for the fourth theory, which is the periodontal ligament traction theory, it talks about the cells and fibers of the ligament that pulls the tooth into occlusion. With the next question or comment by Tanjiro, bone remodeling theory is not that important. Are you kidding me? Yes, you are kidding yourself because bone remodeling theory is important to permit tooth movement. Now to further understand my point and this theory, I will give you an example. So let's say, if an animal exhibits a genetic deficiency of osteoclast, tooth eruption will be prevented, whether the bony remodeling that occurs around the teeth causes or the effect of tooth movement is not identified. Both circumstances may apply. So in addition to these circumstances, let's say that the tooth germ is removed experimentally and the dental follicle is left intact. An eruptive pathway forms in the overlying bone. And what if a silicone replica is substituted for the tooth care? It also erupts. But the only exception among these examples is that if the dental follicle is removed, there is no formation of an eruptive pathway. These experiments and circumstances establish the absolute need for a dental follicle to achieve bony remodeling and tooth eruption, because it is the follicle that provides the source for new bone-forming cells and the conduit for osteoclasts derived from monocytes through the vascular supply. Now moving on with the next comment. You are wrong. My professor told me that osteoblast controls the bone remodeling. Actually, there are some studies and researches about bone remodeling that indicated that control may reside with the bone lining cells, which are the osteoblasts. It is also proposed that these cells under hormonal influence secrete collagenase and other proteolytic enzymes to remove the osteoid layer. In doing this, the cells round up and expose the newly denuded mineralized bone surface, which provides the stimulus to attract the osteoblast to the site. Moving on with a decent question by Anonymous. What is root formation theory? But before we go in detail about root formation theory, did you notice that at first glance, it would seem that the root formation is the obvious cause of eruptive tooth movement? Root formation follows crown formation and involves cellular proliferation and formation of new tissue that must be accommodated by either movement of the crown of the tooth or resorption of bone at the base of its socket. Actually, it is the former that actually occurs. But if occlusal movement is prevented, resorption of bone occurs at the base of the socket. So moving on with the next question by Jotaro. Is root formation that important? Now this is actually important because it illustrates that if root formation is to result in an eruptive force, the apical growth of the root needs to be translated into occlusal movement and requires the presence of a fixed base. But fixed base doesn't exist. The bone of the base of the socket cannot act as a fixed base because pressure on bone results in its resorption. There are advocates of the root formation theory which postulated the existence of a ligament, namely the fusion hammock ligament, straddling the base of the socket from one bony wall to the other like a sling. Actually, its function was to provide a fixed base for the growing root to react against. But the structure described as the fusion hammock ligament is the pulp delineating membrane that runs across the apex of the tooth and has no bony insertion. It cannot act as a fixed base. There are some clinical observations that also indicate that root formation cannot be responsible for eruptive tooth movement. For instance, some teeth move a distance greater than the length of their roots, and eruptive movement can occur after completion of root formation. And finally, experimental resection preventing further root formation does not stop eruptive tooth movement. Yet, root formation may be a necessary prerequisite for eruption. So that's it. Thank you for listening, and I hope you understand something.
Hi everyone, I'm Dr. Alva Castuna, and today I'll be answering questions on Twitter regarding the segment #AskDocAlva. This is in line with the topic Mechanisms of Tooth Movement, which focuses on the different theories of tooth eruptions. Most of you have asked me about the vascular pressure theory and the periodontal ligament traction theory. I will explain those two theories in detail, so please sit back, grab some food, and let's get started. So I have here a question from Nothing But the Tooth. What is vascular pressure theory? Simply put, vascular pressure theory, or also known as the blood thrust theory or hydrostatic pressure theory, proposes that there's a local increase in the tissue fluid pressure in the periapical region that is sufficient to move the tooth. It is known that the teeth move in synchrony with the arterial pulse, so local volume changes can produce limited tooth movement. Next question is from Say Cheese. What is the difference between the vasodilation and the vasoconstriction? Okay, so in vascular pressure theory, It states that the eruptive force is provided by the pressure exerted by the blood vessels within the tooth. So the change in diameter of blood vessels in the periodontal ligament and its surrounding connective tissue causes change in pressure that can increase or decrease. For example, if this is the overlapping tooth and you magnify the part of the periodontal ligament, it will appear like this. So it consists of the ground substance wherein numerous blood vessels are present. So in this diagram, we can see that blood vessels have an increase in diameter, which is called the vasodilation. When this happens, there is an increased hydrostatic pressure in the ground substance. This change in pressure causes the tooth eruption. The opposite of this is called the vasoconstriction, wherein we can see the decrease in diameter of the blood vessels. When this happens, there is a decreased hydrostatic pressure in the ground substance, which decreases the rate of eruption. Moving on, here we can see the numerous blood vessels present in the apical area and the alveolar crest area. So these numerous blood vessels causes an increase of hydrostatic pressure, which results to the increased rate of tooth eruption. So in addition to that, experimentally, increase of hydrostatic pressure induced by hypotensive drugs increases the rate of tooth eruption, while stimulation of the sympathetic nerves causes vasoconstriction and the decrease of hydrostatic pressure, wherein it decreases the rate of tooth eruption. Although vascular pressure can play an important role by generating an eruptive force, opinions differ whether these pressures are responsible for tooth eruption. I hope that is all clear to you. I have here another question from Reality Bites. What is the periodontal ligament traction theory? The periodontal ligament traction theory proposes that the cells and fibers of the periodontal ligament pull the tooth into the occlusion. It states that the eruptive movement could be brought about the combination of events involving a force initiated by the fibroblast. This force is transmitted to the extracellular compartment by the fibronexus and the collagen fiber bundles, which is aligned in appropriate inclination brought about by root formation to bring tooth movement. These fiber bundles must have the ability to remodel for the eruption to continue, and interference of this ability affects the process. A simple analogy of this is that the sailor, or what we call the fibroblast, is pulling on a rope which we refer to the collagen attached to a sail. Sail, which signifies the tooth. So to move the sailor must remain stationary and pull on the rope to have a contraction and then coil it on the deck, which we call the collagen remodeling. Last question is from Tooth Be Told. What is the role of dental follicle in tooth eruption? So dental follicle plays a very important role in tooth eruption. So it secretes colony-stimulating factor 1 and monocyte chemotactic protein 1. And then, this increases the rate of eruption by increasing the recruitment of the monocytes and by promoting the formation of the osteoclast. Thus, osteoclast formation and bone resorption are regulated. So moreover, dental follicles are shown to produce bone-resorbing factors in the coronal half and bone-forming factor in the basal half to facilitate the tooth eruption. In summary, these four theories proves that the eruptive movement is multifactorial. That is all for today. I hope you learned something new from this series. Thank you for listening and see you on my next segment.
Hi, I'm Jezreel Anbi Basa, and for the last part, I'll be answering questions from Twitter about the abnormal eruption of a tooth leading to deformity during tooth development. First question from Ariana 20. What is the normal age for babies to get their first tooth? If you remember during your oral anatomy class, there is a age of eruption for each tooth. So it is always important to note that there is a considerable variation in these timings, the time of tooth emergence. However, Only tooth emerging significantly outside these ranges should be considered abnormal and is indicative of some fault in eruptive movement. Your child's first set of teeth or their deciduous teeth should start to appear in the oral cavity at the age of about 6 or 6.5 months. The front teeth on the bottom jaw, the central incisor, usually come in first, followed by the front teeth on the top. So the rest of the teeth follow in succession after that. Usually by the age of 3, a child will have their complete set of primary teeth, so a total of 20 teeth. Okay, another question from Angelina Jolie. At what age will a baby be considered to have delayed tooth eruption, and why do some children's teeth erupt late? Well, this is a common abnormal eruption of teeth, delayed eruption. Teething. It can be difficult for both the baby and the parent. Maybe you have a sibling in their toddlerhood with no teeth showing yet. Remember that anywhere between the age of 6 to 15 months is considered to be the average normal tooth eruption. If no teeth have come through the gums by the time the child is 18 months old, they should see a dentist. In order to identify abnormalities of the teeth, X-ray may be taken to view the teeth below the gum line. So the teeth that come in late can simply be because of genetic trait. It may be something that runs in the family, or there is a genetic abnormality that causes delays in tooth eruption due to malformation of the teeth. Question from Brad Pitt. Which teeth are most often impacted? Good question. An impacted tooth is a tooth that for some reason has been blocked by breaking through the gum. Sometimes a tooth may be only partially impacted, meaning it has started to break through. But in general, a tooth becomes impacted when your mouth doesn't have enough space for it, and it can be the result of genetics or orthodontic treatment. The most commonly impacted teeth is the mandibular third molars, followed by the maxillary third molars and maxillary canines. By the time that wisdom tooth, your third molars, come in, the jaw has often stopped growing. So the mouth and the jaw may thus be too small to accommodate them, because there's no real need for wisdom tooth anymore. They're typically removed if they're causing problems like pain and dispositioning the dentition. Also, if you have a small jaw, you're more likely to have impacted wisdom tooth. Another question from Jungkooki. What is the difference between impacted and embedded teeth? Similar to my answer from the previous question, a tooth which has fully formed but has broken through the gum into the mouth is either impacted, so like your third molars, which are prone to impaction. So they're also known as unerupted teeth. But if a tooth is not breaking through the gum because of being underbone, it is classified as embedded. So that's the difference between impacted and embedded. Okay, another question here from Titanic Sinking. What causes ankylosis of teeth? And do ankylosed baby teeth need to be removed? Well, ankylosis occurs when partial root resorption is followed by repair with either cementum or dentine that unites the root with the alveolar bone, usually after trauma. However, root resorption does not necessarily lead to tooth ankylosis, and the causes of tooth ankylosis remains uncertain to a large extent. In cases of ankylosis in children, it most often occurs with the mandibular second deciduous molar. The removal of ankylosed baby tooth is not necessary if it does not cause any problems. However, if it's going to be removed or extracted, this would just allow the permanent one to develop straight and strong and in a normal range, that would result in a better chance of having a well-aligned smile. Question from Joking. What are the effects of early loss of deciduous molars? Deciduous teeth can be lost early because of premature resorption of their roots, trauma, or decay, followed by extraction. So the premature loss of deciduous molars can lead to migration of adjacent teeth like mesial shifting of the tooth and to shortage of space for their successor. Permanent teeth can be damaged and abnormal shapes, hypocalcifications, and caries lesions can result. And from J. Hope, what could be the possible dental problems of patients with hyperdontia? And what is the difference between hyperdontia and crooked teeth? Supernumerary teeth can cause a variety of dental problems that interfere with normal oral function and health and present cosmetic issues. So this condition can cause tooth impaction in patients, crowding and misalignment of normal permanent teeth, issues with proper chewing, fusion with permanent teeth, formation of oral cysts or tumors, premature closure of spaces in between the teeth, the eruption of teeth into the nasal cavity, and can cause problems with bone grafting necessary for dental implants. So what's the difference between the hyperdontia and the crooked teeth or yung sungke? Well, supernumerary teeth or hyperdontia is a condition that causes too many teeth eruption in your mouth. Basta it is any excess of tooth eruption compared to the normal eruption ng tooth. While the crooked teeth, there are times kasi na delayed ang eruption as I mentioned earlier. For example, the 4 incisors and 1 premolar have already erupted. So, nawala na ng space for the canine to erupt. So, that is why crooked teeth appears in the maxillary arch. And, yeah, I guess that's the last question. And again, I'm Jezreel Anvi Basa, and I would like to thank some of you from Twitter for your interesting questions. I hope we both learn from each other. Bye!
Cause we here, dopest group tonight. So watch us bring the fire, set the night alight. Shoes on, get up in the morning, cup of milk, let's rock and roll. Dentist soon to be rolling on like a rolling stone. Sing song when I'm walking home, jump up to the top, it's on. Ding dong, notify my phone, congrats, you're good, you're the best, yeah.
This is getting healthy. Can you hear the toothbrush? I'm ready. Life is sweet as sunny. Yeah, this is touching like money. Huh. This tooth overload, I'm into that. I'm good to go. I'm canine, you know I glow up. So let's go.
Cause I don't erupt the force. So watch me move the tooth and break the roots of light. Forming bone and process to the dental follicle. So I'm a erupt, yeah, like a dynamite. Oh.
Bring the teeth in the mouth, remove it in the bone of jaw. You wrap teeth to teeth, deciduous and permanent. Periodontal ligament, also need for the eruption. Ladies and gentlemen, we're ready for more anesthesia. Keep yourself in calm mode.
This is getting crazy. Can't you feel the teeth move? I'm sweaty. Head is getting dizzy. Yeah, these teeth aching like crazy. Caries overload. I got you, and you good to go. I'm a dentist. No, I can fix it up. So let's go.
Cause I couldn't taste tonight. So watch me take that tooth out of your mouth. Hey! Smiling through the city with a little funk and soul. So I'ma paint your teeth like dynamite. Whoa.
Say na 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 na. Teeth are shining bright. Na 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 na. Clean like pearly white. Smiling through the city with a little funk na 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 eh. Smiles are bright like dynamite. Na 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 eh. Na 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 eh. Na 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 eh. Smiles are bright